Healthcare systems, the United States versus Finland. Structure. The United States is a public and privately funded healthcare system. Care is based on insurance coverage. Insurance coverage can range from privately funded insurance to state-funded programs such as Medicare and Medicaid. Medicare is for individuals who are disabled and cannot go through Social Security or those low-income families. Medicaid is for individuals who are 75 years of age or older, or the disabled who can go through Social Security. Patients attend care based on what their insurance covers. This can range from hospital visits to immediate care clinics. This is maintained by the U.S. Department of Health and Human Services. In Finland, they have a national healthcare system. They have over 400 municipalities which act as districts or counties that cover the range of healthcare within that section and also the funding. The facilities work based on the level of care that the patient needs. This means primary care, secondary care, and tertiary care. You do need a referral to advance to the different stages. For example, if you are a patient in Finland and you go to your primary care physician, in order to advance to the secondary care physician, your physician in primary needs to make you a referral to see a secondary physician. They recently switched from a primary care system to a family doctor system. This means that each physician is in charge of 2,000 patients, and they have to work within, I believe, 3 business days to get the patient's concerns resolved to them. This has resulted in an increase in satisfaction with overall care that the patients have received. This is governed by the Ministry of Social Affairs and Health. Funding. The United States spends 17.6% of its gross domestic product, GDP, on healthcare. That is equal to about $2.6 trillion. Even though the United States spends that much on its healthcare, 84% of citizens still rely on private insurance programs to cover the majority of their costs. These private insurance programs are gained through their employer or privately sought out by the individuals. And this can be due to a variety of reasons. Either they do not like their insurance provided by their employer and think they can get better coverage elsewhere. The public sector comprises 48.2% of healthcare expenditures, and this can come from insurance coverage and over the costs or co-pays for your clinic visits. Insurance companies in the United States are often unregulated and operate on a business-only standard, which means they do operate as a commercial business and for profit. Finland spends 8.9% of their GDP on healthcare, which is less than half the amount of the United States. The public sector alone pays for 76% of healthcare costs. Now, the 76% is mainly through taxes, and the taxes come from 2 different sources: the municipalities, or those districts that we were talking about earlier, and through the state. But both of these taxes funnel towards one universal health insurance system called the National Health Insurance System, or NHI. This covers all permanent residents of Finland. They also require all of the employers in the country to provide some healthcare coverage as well. So not only are you getting coverage from the NHI, your employer, you can also get private insurance, so that way all of your expenses are covered. Sometimes a copay is necessary, though, depending on what care you are receiving. Statistics. The United States has an average life expectancy of 78.7 years old. Now, this average life expectancy is low compared to other more developed nations in the world. And there could be a couple reasons for this statistic, but professionals mainly think it is related to poor diet and a sedentary lifestyle that we are accustomed to seeing here in the States. And some more statistics that factor into that poor diet and sedentary lifestyle are the statistics for obese females, which is 36% of the population is 36% of the population is obese for the females, and 35.5% of the population are obese males. And another shocking statistic for the United States, even though we spend so much on healthcare, we spend the most on healthcare in the developed world, and actually the entire world as we know it, we still have one of the worst infant mortality rates among the more developed nations, which means we have 6.1 deaths per 1,000 live births. And again, professionals do think this can be attributed to the diverse quality of care among the ethnic population. The United States also has the lowest amount of physicians per 1,000 group of people. We have 2.4 physicians per 1,000 people. So for every 1,000 people we have less than 3 physicians to cover that area of people. But we do have 11 nurses per 1,000 people, which is, I think, among the highest in the world. In Finland, the average life expectancy, contrasting to the United States at 78.7, their average life expectancy is 80.2 years old. The obese females constitute 21.1%, and the obese males constitute 19.3% of their population. However, according to the OECD, I believe it is a European Union report based on the healthcare systems in Finland. Their report stated that only 18% of the total population is considered obese. So over that 18% of the total population that is considered obese, 21.1% are female, 19.3% are male. Infant mortality rates. While the U.S. does have 6.1 deaths per 1,000 live births, Finland has 2.3 deaths per 1,000 live births. Again, this is less than half of what the U.S. has, even though the U.S. spends more on healthcare than Finland does. Finland also has more physicians than the U.S. healthcare system does. They have 3.3 per 1,000 people, but they do not have as many nurses. They have 9.6 nurses per 1,000 people. The dilemmas these countries face. Okay, for the United States healthcare system is treated like a business. The hospitals you see, or any facility for that matter, the physicians, the doctors, the health insurance programs, all of it operates on a business and a for-profit platform. They are unregulated by the government. They operate solely for their own interests. Which means pharmaceutical companies, again, they operate independently of the U.S. healthcare system. Again, most of the hospitals and other facilities that you go to seek treatment, they operate separately from the government. They are not regulated by the government. They are often owned by big name companies and are part of a big branch of hospital or clinic care systems. Now, these pharmaceutical companies will provide incentives towards physicians that market their product. So oftentimes physicians will prescribe certain brand name drug medications to individuals that really don't need it because they offer incentives and funds towards them for prescribing it. They also receive compensation for referrals to different healthcare facilities or different programs for the treatment of their patients. Costs are covered by numerous third-party systems, private insurance, direct public provision, And again, all of these operate separately and for their own self-interests. The insurance companies alone have a gross income of $800 billion. $150 billion of these dollars went towards overall healthcare costs. So all of this profit that they are getting is purely from raising the costs of their own insurance premiums that are inflicted upon the U.S. taxpayers, that are inflicted upon patients, and even the employers are feeling the heat from the rising costs of healthcare. The insurance companies aren't just rising the prices of their healthcare to gain their own profit, even though that's probably their main goal, but they are also rising it because the cost of doctors, physicians, treatment, the technology that they need to perform all of these tests are included within those rising costs. So they have to raise costs not only to increase their profits, but to cover the rising costs of the healthcare care that the patient is receiving. And it's not even just based on one person. The care, it's based on the overall care of the patients that are being treated. So if one patient is being treated at 10 times the rate that another patient could be treated, the costs are still going to reflect that and are going to increase. And another professional opinion is that the U.S. healthcare system is geared more towards acute care rather than chronic care, because a lot of times you will see in healthcare systems that there are all of these there's all of this new technology, all of these brand spanking new systems that are not needed and do not treat the chronic care that the individual is suffering from. 70% of expenditures are geared more towards chronic care than acute care. And this is in opposition to Finland's dilemmas. Finland's dilemmas stems more with the overall structure of their healthcare system. They want to strengthen their access to and efficiency in their primary care, because a lot of problems that they are seeing is that there are more costs involved for people who are waiting longer to be treated, and as a result of having to wait longer, their conditions are worsening or they need to be treated for additional symptoms or illnesses. And the wait times can vary because they either are unemployed and do not have that additional employer coverage, or it could be a geographic barrier. They could be separated from the closest city, because even though Finland is among one of the more developed nations, it is slightly smaller than the size of California, but only has about 5.5 million people in it. That's, I want to say, less than the population of Minnesota. And so as a result of having all of this space, but such a small population, they are so geographically dispersed that the closest healthcare facility could be hours away. And so they want to strengthen the availability and access these individuals can have to a healthcare facility. That's one of their main goals. Another issue that they're having is they want to promote more integrated care among the different facilities, rather than having to step through the levels that I was explaining earlier. You have to first go to your primary before you can go to your secondary care physician. They want to have it more integrated, so that way you don't have to go to the primary if you don't need to. Or if you can be treated at the primary level, rather than skipping and going to a separate level, it can all be addressed at one level. So that way you don't have to incur so many costs going through so many different systems. They also want to increase communication among their healthcare facilities. That way the same topic isn't being repeated over and over, and certain conditions are being missed in their diagnosis. And as in order to invest in that increase in communication, they are investing in e-health, which is their own electronic medical record system that will collaborate through all of the different in Finland. So it will correspond with primary, secondary, and tertiary care and help assimilate the patient throughout the different systems of care as they go through that process. Thank you.